Today's research to practice is from the updated clinical report published by American Academy of Pediatrics. The last one was published 12 years ago. What I like about this report is that it's independent report. What I mean by that, it's not really published by someone who has a conflict of interest of intervention or other related research. In other words, it's not published by someone who also wrote the intervention manual. What are some main points of this research? I'm just going to highlight 4 of them. One is about 25%, which is a quarter of autistic children experience regression in language and social skills. This happened around 18 and 24 months of age. So what does this mean? I think it also highlights the importance of early intervention when you notice something is wrong and seek help right away. Do not wait for a diagnosis, given how long it will take to get a diagnosis. And also pay attention to your child when your little one is around 1.5 and 2 years of age. It's not mean you have to live your life in fear. It's just saying, when you play with your little one, pay attention to those red flags, the eye contact, the initiating conversation, initiating communication, and a gesture, things like that. The second highlight is that about 10% of children with autism, they no longer meet criteria by young adulthood. So who are these people? These are children who had higher cognitive skills at 2 years old. They received early intervention services, and then there was a reduction in repetitive behavior, meaning they spend more time engaging with their friends, playing with their friend, playing toys appropriately instead of engaging hand flapping or other repetitive behavior. And then the third part is about genetic factor. So there's meta-analysis reported that there is a 98% concordance rate for monozygotic twins. This means these are identical twins, and there is a 98% concordance rate. That means this is highly genetic. If you have identical twins, there's 98% of a chance that both of them also have autism. For dizygotic twins, the concordance rate is about 67%. And they also look at the common mutation. There's no specific mutation genetically that's unique to autism. There's a lot of overlap with other disorders such as intellectual disability, epilepsy, and schizophrenia. Those are some main points about the prevalence, about diagnostic change. Around 10% children actually they no longer meet the diagnostic criteria by young adult, and some genetic factor that again reconfirm that this is a genetic condition. Then let's talk about intervention. What did this updated clinical report say about intervention? Well, they say the most evidence-based treatment models are based on principles of ABA. ABA can be child-led, can also be clinician-led. So ABA is not sit at a table, a clinician sit across the table and start to do discrete child training. A lot of people out there think ABA meaning drilling. That's not the case. ABA just means that the treatment is based on learning principles, based on behavioral principles. The report also touched on the naturalistic developmental behavior intervention. So this is NDBI, is a combination of ABA strategies in combination of some developmental strategies. You will see these interventions are embedded in the social activities, blowing bubble, diaper change, getting ready to go outside, a meal time. So during these activities, the child is being taught some social goals and then individualized goals. The most extensively studied NDBI is Early Start Denver model. There's a lot of books and videos out there about ESDM. I think one of the very interesting, also I think it's the most important information conveyed by the clinical report is that there's a lot of commonality among different interventions. They may say different names, but there are a lot of common things these interventions use. There's 5 of them. One, just some examples. One is they all use principles of ABA, which means they reinforce the appropriate behavior, and then there is a differential reinforcement there. Then there is a systematic approach. What I mean by that is that you have a manual to train different people involved in the intervention. You have a manual to train your therapist, train your parents, the teachers, so everyone is on the same page. This one's important. There is individualized treatment goals. So the goals are based on assessment, based on what this child needs at that certain stage of development. And then there is a child initiate teaching. This is your follow into a child lead while your child is playing with the toys. You join the play, you imitate, you copy your child, and then you imitate, and you provide some actions for your child to imitate. And the last one is adult prompting. So this is about how you fade prompt. Initially, you may have a one-on-one prompt, a physical prompt, a partial prompt, and eventually you want fade the prompt so that the child can be independent. This is just a snapshot of the most recent clinical update from the American Association of Pediatrics.